Yo, what's going on, everybody? This is Edward Williams, founder and creator of Health Biting Necessary, and also one of the coaches for the Fast Life 28-Day Challenge, which we are currently in the beginning of our launch right now. So if you're interested in that challenge, go ahead and click the link. What I wanted to speak to you all about is type 2 diabetes, of course. You hear me talking about it a lot. But last weekend, I believe it was Saturday, I did a video talking about one of my new patients. And about the protocol, the fasting protocol that I now have her set up on. And she was used to seeing her fasting blood sugar ranges in the 200s. That was a norm for her. And like I said, she was somebody who was, as she considered to be doing her best as far as trying to manage this diabetes and not let it get out of control. But really, it seemed like no matter what she was doing, that it was always elevated. Especially in the morning, and so her blood sugars were in the 200s. And saw her last week Thursday. It's been a week now that we've been working together, and put her on a fasting regimen. And I put her on her finger stick regimen, about how many times she should be checking her finger sticks. I told her what she needs to be doing, what she needs to be eating, all those things. Laid out the whole entire plan for her, and just told her to take action. She came back in to see me, and this lady wanted to cry. She wanted to cry because she felt like this is the first time since she's been diagnosed with diabetes that she was in control. All the other years, she felt like she was just going along with whatever they were telling her, not seeing any results, but also getting worse. And she told me that she felt trapped in her body. She felt trapped in her diagnosis, that she felt trapped in this system, in this back and forth between multiple doctors, and that within the 7 days, this is the first time that she felt like she was in control. Her blood sugars for fasting has been around 130 now for a whole entire week. 6 days. 6 days has been around 130, and she hasn't seen that. She said, I have not seen that. Not only that, she hasn't seen a blood sugar higher than 156. She hasn't seen a blood sugar higher than 156. She said before she was used to seeing 250s and 270s, and that was just the norm for her. But within 7 days, she's seen a radical difference. Now, you all know that I use the word radical a whole lot. She was using the word radical, and both her and her daughter's not even a patient of mine, but she's benefiting from what her mother is doing, because she is also diabetic. She's young. She's 28 or 29. She's young. And she's also diabetic, and so she's doing the same thing, and she's seen the exact same changes as well too. And so it's beautiful because they're doing this together. So the question this lady asked me, and once again, I told y'all how much it bothered me when she asked me those questions last time, because I can look in her eyes and tell that this is someone who's really trying her best to improve her health. She's just not allowing whatever happened to happen to her. And so when I heard about all the things she was doing based on the recommendations of her diabetes coach and based on recommendations of her primary care provider and nutritionist, it just pained me to see somebody doing those recommendations and only getting worse. And so her question to me was, why hasn't anyone else told me to do this? Why are you the first one in all of my years of being diabetic? Why are you the first one to ever mention anything about fasting? Why? And I didn't want to tell her at that moment. I didn't want to, because when I start talking about those things, I get activated and I go into a different mode. And I didn't want to do that this time. And so I essentially told her, I was like, maybe they don't know. But I'm going to let you all know why she hasn't heard that advice before. So what we have to understand, and this is maybe a harsh reality for a lot of people to come to, but we need to understand that, especially when it comes to type 2 diabetics, the system sees you as an asset. The system sees you as something that is in their system, that they own your patient file, and that you're something that will continuously bring them money on a monthly basis. Doesn't matter if you are taking the least amount of medications. I mean, I have people who tell me I'm only taking 500 milligrams of metformin for now. And you gotta understand that if you're taking metformin and you think you're taking the minimum amount, and you think that doesn't add to the revenue of the healthcare system, you gotta understand that whatever you're paying, let's say you're paying like $10. All right, cool. That's not the price they're billing. They're billing more than that. But not only that, you multiply that by thousands of patients, because you have thousands of patients that are now being prescribed metformin for pre-diabetes. And then they're being sold this game. They're being sold this pimp line that you're not diabetic, you're pre-diabetic, but we're going to go ahead and start treating you with metformin. That way you don't become diabetic. And what happens? You become diabetic. Why? Because the medication does not treat the actual root cause. It doesn't do anything for the reason why you are insulin resistant. It does nothing at all for you. However, it does work to the greater benefit of the system, because they're now getting early revenue. They're now getting early profits on someone that wouldn't have been a customer because they weren't diabetic. So by labeling you pre-diabetic, we can now start making money off of you. And the panel who decided that back in 2008, and then they went back to the panel in 2013. The panel who decided that decision to start treating people pre-diabetics with medication, 9 out of 12 members on that panel were actually paid by diabetic pharmaceuticals. They were actually paid by the people who make these medications. Now, you can say what you want. You can say what you want. I call it criminal activity. These people are thugs. They're gangsters. They're dangerous. They're cold-blooded. They don't care about you as a human being. They have no intentions on truly liberating you from this condition called type 2 diabetes. And so you have to understand that this system will find all of these fancy and neat, cool ways to get money off of you, start profiting off of you well before your official diagnosis. And we have to come to the realization that that's just how they see you. Also, for people who are diabetic, and even if you think you're taking the least amount of medications, you may be taking the least amount of medications at that time. You have to understand that one medication, metformin 500 milligrams, becomes metformin 500 milligrams twice a day. That means how much you were paying for the medication is now going to also increase, because now you need more medication. That one medication, 500 milligrams of metformin twice a day, will now become 2 medications, give or take 2-3 years, and that will now be 2 medications you're on. They're going to put you on a sulfonylurea. You have to understand that these medications are not benign. All medications have what they call side effects, because they chemically alter the physiology of your body. So now we have a patient who started off on one medication, now taking that one medication twice a day, but they're also taking another anti-diabetic medication called sulfonylurea, which is one of the worst drugs, point blank period, especially for diabetes, especially on your pancreas, because it's forcing the pancreas to secrete insulin. It's pretty much bullying your pancreas to secrete insulin even when it doesn't want to. Those 2 medications over time will eventually become insulin. You'll then start injecting insulin. And so these folks are in for the big picture, the long tail. They may not make that money on the front end, but on the back end, they're upselling like crazy. Your 500 milligrams of metformin will turn to 1,000 milligrams, which will turn into glypiride plus the actual metformin, which will turn into insulin plus the glypiride plus the metformin, on and on and on and on and on. Next thing you know, oops, kidney failure. Next thing you know, oops, stroke. Next thing you know, oops, blindness. Next thing you know, oops, erectile dysfunction. Next thing you know, oops, amputation, gangrene, infection. And so these folks are making money multiple ways. Now, once again, I told y'all, we need to get into bottom block questions. This is an idea that I got from Professor Aaron Smith, where you're not playing the game of Jenga the way they designed Jenga, which is where you're just pushing out blocks, taking them out, and stacking up on top. You're not trying to be nice. You're not trying to be careful as far as not knocking over the actual little building. You want to knock it over. Therefore, you go for the bottom block. So you start asking bottom block questions. Now, one question that you need to ask yourself is, do you want to reverse your type 2 diabetes? Yes or no? Because if the answer is no, then you don't need to go to the next phase. Just stay right there in that phase and continue doing what you're doing. If the answer is yes, you do want to reverse your type 2 diabetes, your next question you have to ask is going to be for your provider. If you can even contact them, if you can even speak to them, if you've even met them. Your next question needs to be to them is type 2 diabetes reversible? Has anybody ever reversed type 2 diabetes? Now, if they tell you no, there's two things you need to do. One, y'all two can sit down and do some research. You should do the research first. That way you can have some literature to actually go over before asking that question. And then maybe they'll come to the conclusion that this thing is reversible. Now, if they say no, it's not reversible, and no, they're not looking into it, this is the guideline, this is what you need to do, I recommend you run. I recommend you run, because a provider who is not open to change, a provider who is not open to any new information, a provider who is a slave to the protocol, a slave to the system, a slave to the guidelines, they're not going to think outside of the box. They're not going to help you heal. They're going to promote and push the same old thing, which gets you in a situation where you have an industry that is making billions of dollars per year, billions with a B, and they're getting no improvements, no results as far as diabetes reversal. And then they got the nerve to come back and ask you for a donation. Can you help us? Can you help us save a life? Can you help us find a cure? Bro, you're making billions of dollars per year and you want to ask us for a donation and you produce no results whatsoever? Yo, miss me. And so if your provider is not even aware that diabetes can reverse, that is a red flag. You need to now start trying to find another provider who is open, who understands that type 2 diabetes can absolutely be reversed. Second, if your provider understands that people have reversed type 2 diabetes, ask them what they have done and can I do the same? But also, why didn't you tell me that in the beginning? Like, why didn't you let me know that this thing could be reversed? Because if I knew it could be reversed, then I wouldn't be taking these medications. I would be doing other things to actually reverse it. So you have to get to asking these questions, not only just to your provider, but for yourself as well too. Is type 2 diabetes reversible, or is it a chronic and progressive disease like the American Diabetic Association claims? Because that is a flat out lie. It's a flat out lie. That's why I say you can't sit around and wait for these folks to tell you the truth. They're not going to tell you the truth because they make money off of you being quote unquote sick. They make money off you being quote unquote diabetic. You being sick, your pain, your agony, your struggle is profit for them. And you have to dissect that and really understand that, and then figure out what you want to do with it. Now, if you're tired of being bullied and you're tired of being pushed around this thing they call the healthcare system, which is not a healthcare system, it is a disease management system and thing. If you're tired of that whole entire thing, I highly recommend that you join the Fast Life 28-Day Challenge, because in this challenge, our members are getting radical results. They're getting radical improvements. We have people who start off the challenge with a fasting blood sugar of 140, and by the time they get done with our challenge, they'll be at a 100, and if they continue to do the cycles again and again and again, that fasting blood sugar will get lower, their A1C will start to drop, they start making massive improvements, let alone they're going to lose weight. But you have to get the information. You have to empower yourself. You cannot wait for a system that is designed to see you fail. You can't expect them to help you heal. You can't expect a system that actually makes money off of you being an asset, makes money off of you being sick, to now help you heal. It's not going to work out. The Fast Life 28-Day Challenge is a structured program that we have hundreds of members who come through, and we form a community, 3 coaches. We walk you step by step on a daily basis on what you need to do to start fasting, how to incorporate that into your lifestyle. This works great if you are diabetic. Now, we do have protocols. We have certain regimens. We have recipes. We have recommendations. We do coaching, live coaching weekly on the weekends. We have information for the members to go through. We have everything structured and laid out for you, but most of all, we have a community of people who have already been through what you're going through right now. Yeah, you have members who have already been through what you're going through right now, who have taken action, went through the challenge, and found out that it's possible to reverse type 2 diabetes. So you got two choices. I mean, well, you got multiple choices, but the two choices I want to talk about right now is continue going on with the system, try to do it on your own and improve it, or joining a community of people who have done this is going to continue doing it. And not only that, we value you as a member of our community, because we understand that you probably have people, younger people that you are influencing, whether they be your children, your nieces, your nephew, people around you. If they understand that you're diabetic and you are saying that this is something chronic and progressive, well, they're going to take on that message as well too. If we get you into the challenge and we shift the paradigm and help you understand that this is a lifestyle condition, this is reversible, and this is what you need to do, you now take that message and you spread it amongst your people, you spread it amongst your community, you spread it amongst your family, you spread it amongst the younger generation. That way we don't go through another generation of people who just says, it runs in my family. That's a trick bag. It doesn't run in your family. This is not chronic and progressive, and it's absolutely reversible. So the decision is yours, people. You know, we have something set up specifically for the community. It's up to you if you want to join it, but I want you to let you know we have members who have had radical improvements. All you have to do is check it out. All right, so that's all I wanted to get on here and say. I really appreciate you all, and let me read these comments real quick and let me get back to seeing these patients. What's going on, Ramona? Brian, Angela, what's going on? Clover, what's going on, brother? Lakeisha, what's going on? What's up? What's up? So agreed, been down that road. Yeah, run fast. So true. What's going on, Clover? I know someone that was on insulin for years and his doctor expired when he went to another doctor, low pumping medication. Appreciate it, Clover. Appreciate it. All right, y'all. So I appreciate y'all. The link for the challenge is in the description. We start the next challenge on September 2nd. The final day to sign up is, I'm not sure the final day to sign up, but it's right around the corner. So if you want to sign up, just click the link in the description. I'll holler at y'all later. All right? Peace.